Long-standing neck pain, stiffness, or tingling in the arms often has a common cause: cervical spondylosis. Cervical spondylosis is age-related wear and tear of the 7 small bones, discs, and joints that make up the neck. Over time, discs thin, ligaments thicken, and small bone spurs form, narrowing the spaces where nerves travel. Most people notice neck stiffness, headaches at the back of the head, and aching across the shoulders. When nerves are pinched, pain, tingling, or weakness may travel down the arm into specific fingers. Pressure on the spinal cord itself, called myelopathy, can cause clumsy hands and unsteady walking. Doctors diagnose it through a physical exam, X-rays, and often an MRI to see nerves and the spinal cord. Most people improve with non-surgical care, physiotherapy, posture correction, medications, and sometimes steroid injections. Surgery is generally considered when nerve or spinal cord compression progresses, or when conservative care has not helped. Common operations include removing the damaged disc from the front of the neck and either fusing the bones or placing an artificial disc. Other approaches work from the back of the neck to relieve pressure across multiple levels of the spinal cord. After surgery, most people walk the same day, return to desk work within weeks, and continue physiotherapy for months. Risks include infection, temporary swallowing difficulty, and rarely nerve injury or the need for further surgery. Good posture, regular strengthening, quitting smoking, and supportive pillows help protect the neck for the long term. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.